Hello, my name is Jessica Melcher, and I'm a social work consultant with Advanced Health Institute. Today, I'm here to talk about addressing behavioral health needs in long-term care. My goal is to help us better understand and serve our residents while giving a quick introduction to the current CMS regulations for providing behavioral health services. What are the behavioral health needs of our residents? Research shows the top 3 psychiatric diagnoses in nursing homes include dementia, depression, and anxiety disorders. Now, while dementia is not considered a mental illness, we do know it is a brain disorder that can have significant impact on mental health. Other diagnoses we might see include bipolar disorder, personality disorders, schizophrenia, and post-traumatic stress disorder. We also encounter residents coping with substance use disorders. We know that the scope of this issue is significant. Studies indicate between 58 to 91% of our residents are diagnosed with a mental disorder, and these numbers do include dementia. Depression alone is diagnosed in 30 to 40% or more of our residents. We also know depression is often underdiagnosed, and it is more prevalent in nursing home residents than in seniors receiving other types of long-term care, such as home health care or adult day programs. Anxiety disorders are also quite common, seen in between 3 to 20% of residents, and substance use disorders are diagnosed in up to 10%. So what are the current CMS regulations in place? We can refer directly to Statute 483.40, which reads, each resident must receive and the facility must provide the necessary behavioral health care and services to attain or maintain the highest practicable physical, mental, and psychosocial well-being in accordance with the comprehensive assessment and plan of care. So what does this mean for us in practice? Upon further examining the regulation, we know that taking an interdisciplinary team approach is key. So our IDT consists of qualified staff, our resident, the resident's representative if applicable, and family if possible. So we want to take a facility-wide approach. We're going to address behavioral health needs through 3 ways. The first is through comprehensive assessment. The second, through person-centered care planning. And by person-centered, we mean that we are focusing on the resident as the center of control and helping them to make choices about their daily lives. And third, through implementation of that individualized care plan. During the assessment phase, it is critical that we identify an accurate mental health diagnosis. We need to obtain the resident's history and know their prior level of functioning. Not only do we need to have a diagnosis on record, we need to know what specific symptoms they experience. We also need to know what their individual responses to stressors might be. This will inform our care planning process, which again must be person-centered, meaning we are focusing on the individual resident, giving them choices and putting them in control. And we are developing individualized interventions for behaviors. So we are no longer choosing a generic intervention from a drop-down box, but we are coming up with information that is specific to this resident and their goals of care. This process is informed by a strong documentation system in your facility in which all staff have the ability to document observed behaviors so that we can learn what our resident might experience and what might be helpful in intervening. Lastly, behavioral health care is delivered through implementation of this care plan, meaning the care plan is consistently implemented by trained staff. That means across disciplines and across shifts. It might involve making referrals or appointments or connecting clients with services as appropriate. These can be off-site or on-site and might include referrals to psychology, psychiatry, support groups such as AA, developing meaningful activities, reconnecting clients with family or cultural heritage. It's also essential that we are continuously reviewing and revising our care plans so that as we learn more about our residents, we're using that information to help better serve them. The general goals of following these guidelines include creating an environment that promotes the emotional and psychosocial well-being of each resident. This means we want to create a space in which we might prevent behaviors from occurring. We're meeting our residents' needs using an individualized approach that is unique to the specific resident, so we're implementing person-centered care. And we wish to achieve expected improvement in behavioral health or at least prevent unexpected decline. Thank you so much for joining us today. I hope this information was a helpful introduction to this topic. Please contact us if we can further assist with behavioral health needs.